Welcome to this, our first of our digital learning events, all about the Prevention Concordat. My name's Richard Taunt.
My name's Lily McCool.
And I'm Anna Howells.
And over the next 59 minutes, we're going to be talking about what the Concordat is. We're going to be talking about the digital events coming up. We're going to be talking about the face-to-face events. So thank you very much for joining, wherever you are today. Just out of shot is a very grey London. So wherever you are, we hope that you are somewhere slightly sunnier than here. This is a programme run by Public Health England, supported by Kaleidoscope Health and Care. We're a social enterprise set up to bring people together to improve health and care. So we're going to be throwing quite a lot of information at you today, but we'd really like to spend a good amount of time hearing your questions, your views, your reflections on what we're saying and what's coming up. Anna, how can people get involved?
Yeah, because of the volume of people on the call, we won't be taking questions via voice. We'll be taking them via the question box that should be on your screens, or feel free to email us at hello@kaleidoscope.healthcare. That is correct.
hello@kaleidoscope.healthcare.
Yeah.
Excellent. If you're really wanting to tweet along, you can do that as well. Lily, we've got a hashtag.
Yeah, we have hashtag Prevention Concordat.
Lovely. It's a nice snappy one.
Yeah.
That, isn't it? Just a workout for the fingers. Excellent. So I think without further ado, Lily, we'll start off just with a bit of context about the Prevention Concordat.
Yeah, so I mean, see, everyone who's online knows a little bit about Concordat, because otherwise you wouldn't be here. But what I wanted to do is just sort of go back a little bit, tell you a little bit more about how we've been putting this together. So we started with actually, the great opportunity that we had through the 5-year forward view to galvanise action towards encouraging every area in the country to have better prevention planning arrangements. And we've extended that a little bit so that we're also talking about other organisations as well. So it's areas, it's organisations, so that really we are taking everybody into doing a little bit more action on preventing mental health problems and also promoting good mental health, and that in a protective way as well. So over the course of the next series of events and sessions that we'll be helping you explore and sharing knowledge about what we know about what works, and also that you've told us about what works about cross-sector activity, and that's particularly involving health and wellbeing boards, local authorities, the NHS, employers, as you can see, quite a wide-ranging sort of sector, and that includes the private sector as well as the public sector. And as Public Health England, one of the things that we've been doing so far, and we'll be doing more of, dependent on the sort of things that you'd like us to give us, the indicate that you'd like us to add to our suite, is doing more about making sure that you're able to use the best data available so that you can plan and commission the right mix of provision and needs for your areas. And again, particularly focusing on reducing health inequalities and increasing equity. This session today is part of a whole suite of tools and products that we've already released. But again, I just thought we'd flash that up on the screen for a moment so that people again are familiar with some of the things that you've already been able to access online and we'll continue to add to. But also highlighting as well that this is very much a growing programme. We started back in August with our launch and are continuing to add to that to grow this as a movement. What we also want to do is make sure that everyone understands and engages in this, both as a cultural movement, but also as well as all of us being sort of actors for change, again with our professional and personal roles, and again our sort of corporate responsibilities as well. There's a number of dates for the diary that we've already flagged, as well as we sort of indicated the fact we've got the workshops that have started yesterday, in fact, actually in Bristol, which was amazing, in fact. And I don't often actually use, I'm a very enthusiastic person, but don't often use the word amazing about an event. And it was kind of great to see quite such a range of people coming together with actually, so particularly in such a short amount of time from when we've started this piece of work going. And that, again, you'll see that we'll be travelling around the country in an extended version from the way that we did last year, because again, last year we looked at what were you saying would be helpful. This year we're continuing that, but also adding and reflecting back some of that knowledge and practice and experience. So we're almost sort of travelling around in a star-shaped fashion. Our next stop is Durham, then we have some time in London, back up to Sheffield, Nottingham, over to the southwest again, and then sort of circling rounds the country a bit. So we do Birmingham, London, and ending in Liverpool at the end of March. So there's plenty of opportunity for people to be engaged. But one of the things that I think is particularly important, and why we're choosing to do so much in the localized sphere as well as the online, is we're encouraging communities to come together as communities of practice, either as professionals or actually if you're colleagues that work together in an area. That it'd be great again if you are coming to the face-to-face events as a group. So again, you can take away and plan what you're going to do afterwards, because again, obviously this is very much about action and doing, not just talking. And as well, obviously you've made your way here in terms of finding that our webinars, and again we'll be continuing those throughout the next 3 months and potentially longer. But also, if you want to register, then you can do that through the website. And again, so if you start off with at preventionconcordat.com, but also we will be sending out some additional invitations as well that you can share with your colleagues.
Lily, thank you very much. It's probably worth making clear at this point, we didn't choose the locations of the events to draw a star across the country.
Yeah.
We weren't looking to make
we weren't challenging.
Yeah,
we didn't decide we were going to deliberately challenge ourselves in that way, but it makes for very interesting progress. And I think that what also will happen with that is that we are kind of gathering and iterating as we go along. So you will be disadvantaged by coming to the earlier events, but actually everything shared at the earlier events will actually then be sort of distributed further along the line, and also back online as well.
Excellent, good. And so Lily, you flagged, let's just go back 1 second. There's already a huge range of resources out there. Where can people go to get hold of all of these?
So fortunately, thanks to Google, if you simply type in Prevention Concordat into Google, we are at the top of the list there in terms of which is an indication of how many people have actually already downloaded the resources. But they are available on the .gov website, so you can either go to that through the phe.gov.uk or through the ordinary.gov.uk portal, or as I say, you can go for it through Google.
Excellent, great. And so we very much welcome any sort of questions, reflections as we go through. Just one from me, Lily, to kick off before we then start to talk more about the events in detail. Lots of people sort of seize upon that Concordat word and think, what does this mean? Is it something which individual organisations sign up to, or areas? Do you want to say a bit about that?
Yeah, so we're hungry for change, if you like. So we are approaching this in 2 ways. So absolutely, Concordat is a bit of a deal that people sign up to. So we started off with national organisations, mainly to get the ball going, and that's been national organisations with a local footprint, getting them to sign up and also offer up some resource in terms of what is it that they are going to practically do and change over the next few weeks, months and years. We're also just starting the next phase, which is about local areas signing up. So that is, and we're encouraging through health and wellbeing boards as an easy way of sort of having a coordination of in terms of sign off, is that we actually have all local areas will have the opportunity to sign up. And the condition at this point is that, one, that you are signing up to be part of the Prevention Concordat movement, so you're going to improve your plans, and also identify some champions at this point, particularly elected member champions, but also others as well. So that's it's a good opportunity now at this stage for people to be getting involved and signing up.
Excellent. And so that element of the deal is about showing commitment, showing what an area is going to do.
Yeah.
And is this just public sector, Lily, or can other sectors get involved?
So that's been the brilliant thing, actually, is that we started public sector, and actually the appetite for this, and again the opportunity for everyone who's involved in terms of actually doing that change and working with others, is that we have another number of private sector organisations that have come forward. So that includes some of the larger housing associations, which are in the sort of business model, not necessarily simply the ones that have got the pure charitable side, but also as well a number of charities have come forward, and networks. Again, you'll see the list of signatories on the .gov.uk website, and we'll keep adding to those as well. And then we're also going for parts of government as well, or those areas where we can use that influence to involve others. So and people are offering up in terms of what they're doing as their actions, things from changing how they are, so some organisations saying that they're going to be training all of their staff in Connect 5, and also adding to that some train the trainer options as well. So those train the trainer people will also be training people within the wider community or within other organisations. We have others where they're talking about adding extra support to schools, again at no cost as well. So again, this is a real opportunity to work together.
Excellent, Lily. Thank you very much. Again, if you have questions, reflections, comments, Anna, how can people get involved?
Yep. 2 ways to join, either using the question box facility on your screens or by emailing hello@kaleidoscope.healthcare.
I would really welcome any feedback as we go through. Lily, the last one from me, and then we'll start talking about digital events. We have this whole series of events coming up, and we've termed them learning events. There's lots of other things we could have called them. They could have been workshops or masterclasses or instructions from on high. Why learning events?
Yeah, so I'd start with this isn't a top-down program or piece of work. This is a collective opportunity, and so I think it's really important to emphasize that we all have something to offer, and even the fact that we got to this stage of having a prevention concordat was from taking from the paths that people had already started to take locally at different levels and depths and breadth, but actually again what we wanted to do is bring that together and show everyone the different things that they can do that work, but B are also transferable, and C adaptable as well. So at the end, we are not looking for an identikit model everywhere across the country. We're looking at everybody being able to do something different, which is why therefore it's as much about learning, and also therefore we are learning here in terms of the coordination team, whether that's at PHE or at Kaleidoscope or Centre for Mental Health and others that have been involved. We will also be learning as well, and then reflecting that back in terms of our next steps and work.
Excellent. Thank you very much. So I think we're just going to move on to talk about some of the digital events we've got coming up. And as Lily said, well done for making it to this, our first webinar. We're thinking you've made it here deliberately. If not, you're still very welcome, if it was a pure accident. But we're having 9 digital events, 9 of these webinars coming up over the next 2 months. And let's just have a look at the dates for those. So they run throughout the period we're running the face-to-face events, which we'll talk a bit more about in just a second. And how we're looking to structure those is that we're going to have 5 specific webinars about the 5 sort of planning domains, which were sort of part of the structure of the Prevention Concordat planning resource. So to go through in order, the second of these webinars is going to be about partnership and alignment, which is going to be on the 18th of January. We then move on to needs and asset assessment. 25th January, we talk about translating need into deliverable commitments on the 31st of January. 14th of February, Valentine's Day, possibly appropriate, talking about defining success outcomes. Before on the 22nd of February, we talk about leadership and accountability. Again, all of this is on the preventionconcordat.com website. We then have 2 webinars, which are the 8th of March and the 15th of March, where currently and deliberately there isn't a topic. And we've termed these our sort of viewers' choice webinars, where as we go through this series, we are really interested in what are the topics which we've missed or you want to hear more about. And since we decided we'd have these viewers' choice, Lily, I think we've probably come up with about 17 different things which we'd like to do in the sessions. So we'll probably run some sort of process where we'll have a long list and a short list, and we'll have someone sort of take out an envelope and say the viewers' choice topics are going to be this. But we'll have 2 topics which are purely in response to viewers' requests. Before finishing, our final one is on the 29th of March, where we'll be reflecting on the whole series of webinars and thinking about what happens next. It's well worth saying that these webinars will all be recorded, as is today's, and available again on the preventionconcordat.com website. So if you want to watch back afterwards, or if there are some you can't make, they're all 1 till 2 p.m. So they're designed to broadly fit into a lunchtime break. But you can watch those back. We're also going to be producing very short 90-second summaries of each webinar about the key points. So if you don't have a full hour to watch it back later, hopefully you'll have a minute and a half to capture those points. If you don't have a minute and a half, well, you have my sympathies. It sounds like you have a very hectic job. So that's the broad structure of the digital events, what we're trying to do is we've designed the 9 digital events and the 11 face-to-face events as a way of sort of complementing each other. So if you come along to the face-to-face events, you might find us at a number of points saying, and we'll be going into further detail about this on the specific webinar. So in those webinars, we're going to be hearing from a whole host of speakers from national organisations, local organisations. It might be, we haven't confirmed yet, but it'd be quite nice to get some international experts joining, using the power of technology to be joining some of those as well. So I think we're going to have a range of really interesting talks and speakers, but those discussions are going to be made by being discussions. So we'd really like you to join, to send questions, to engage in a debate. And Lee, I thought this point you made really well in terms of the Prevention Concordat success isn't about everyone doing exactly the same thing in every area. It's about where we can share and learn, but adapting to local specific circumstances. And so hopefully through those digital events and through the local events, we want to hear some of that sort of local texture, some of what people have adapted to particularly work for their area, for their organisation, and where there might be similarity to others, but actually where there might be entirely legitimate differences. Anna, what haven't I said about the digital events?
I think you've covered everything, Rich, but yeah, just again, all details about the digital events and the face-to-face events can be found at preventionconcordat.com.
We should have had a sweepstake about how many times we'll mention the web address, preventionconcordat.com. I think for up to 5 already. Play along at home. So the last thing to say, of course, as you'd expect, all of these are completely free. They're completely open to anyone who would like to join, so please do share widely. Lily, should we talk about the face-to-face events?
Yes. So as I said earlier, we actually had our first session yesterday, and what we are wanting to do is really focus people on, we see, taking the opportunity of bringing you together, and that precious time is to really focus on the things that can only be done in that face-to-face medium. So, we've taken the brave step, if you like, of sort of moving away from some of the traditional methodology of, sort of all being about slides. Of course, there will be some slides that we will share in lots of reading material if that's what you want and helps you learn. But actually, we have demonstrated yesterday, and we'll be continuing on that path of actually making sure that there's plenty of opportunity, both for you to reflect on what you're hearing from the sort of the key presenters and the key leads for workshops and focus sessions, but also as well to share what you have as well. And that's both in terms of content, but also about those networks and bringing people together. So, for example, one of the things that came out of yesterday, which was actually slightly unpredicted, was that we are now going to be having a future spin-off, which is particularly looking at the theme of housing. So that may be reflected in one of the webinars as well, but it will be a particular strand of work, which was mushrooming, but actually, again, the events consolidated that. So again, there is lots of reason to be there, both in terms of what you'll take away and learn for yourself, but also how you will directly influence the direction of travel. So it continues to influence you. So far, we've been, many of you will have already had a direct invitation, and we're continuing that path of targeting some people that we really absolutely want there, are our key influencers, but also as well to keeping that principle of keeping it open as well. So if there's anyone that you particularly think should be invited, then do get in touch with us through preventionconcordat.com, and also we'll make sure that they get a particular invite, because again that also encourages people to be thinking about the issue. Even if they don't make it to the event, they might then get more involved in your work locally as well. We've already made the general programs available on the website, and the fine details of those will be refined as it close to the day. So you'll find that again there's that blend of that national input, but also some local connections as well. So again, you can pick up and run quite quickly. I'll be speaking at all of the events. We also have, I'll be accompanied by Richard, who'll be, kind of great at kind of making sure that we all get the most out of the day. And then we've got a range of different people as well. So, for example, we have Andy Bell from Centre for Mental Health, who'll be talking generally about that sort of interconnection with physical health, but also in particular about the mental health champions work and engaging people like elected members and other decision makers. But there is again and we sort of continue to iterate that as we move around the country. In all cases as well, we've made sure that where there is a lead DPH for the area, or other people that, you know, again, are, you know, help get that traction, then we are at making sure that they're there, or closely involved in some of the planning as well. So, you know, that this is going to align with the work that you've already got underway, rather than sort of take you on a different track.
Great. Lily, thank you very much. You said we've got 11 events. We're one down. Had Bristol yesterday. What particularly pleased you about Bristol, and what if there's anyone on the line who's just wavering about, is this going to be a good use of my time? What am I going to get out of it?
Yeah, so there were two things. Is that one, there were absolutely people who have been working in this field that had never met before. Some of it it wasn't that they weren't aware of each other, but they'd never made that connection. So that was kind of, you know, again, one of those that immediately was a great tick, that they'd never met and made something of having met. So that was useful. Then I think there was also that thing that we had people opening the door a bit really into, and but partly through that example, but others where they were opening the door into other either locations or particular groups that we had wanted to talk about in more depth, but actually needed some more insights on. So, for example, we did a little bit more on sort of prisons than we had initially thought we would be able to. So that was a great opportunity as well. And then I think as well that that, you know, the people I talked to, obviously slightly biased, but also the people I talked to all were saying that they will therefore go away and do something as a result. So there was something different that they were going to do, either about their own work, or, you know, sort of talking to people more senior, or, you know, again, influencing people in other organisations. So that was, again, you know, a good healthy work. And I think I saw one of the first insights on the feedback was that, you know, everybody said they would recommend it to, nearly everybody said they would recommend to another to a colleague to come to another one, which again is a, you know, one of those really practical sort of signs that the fact that other people the participants got something out of it was actually really valuable.
And these are genuine results. This isn't us just having cooked for the first event. But the evaluation was really strong. Yesterday, and I'll turn to you for your highlight from yesterday in just a second. But I think just to pick up on your point about sort of some of the practical nature of it, I thought what was really nice about yesterday was you had people showing sort of quite practical approaches to different issues. And of course, I don't think anyone was there thinking that they had all the resource they needed. But actually, how you construct strategies and plans which work in a really sort of in some ways difficult climate was really interesting.
So we had one example which actually was talked about at several points through the day, which was that had come from the, you know, participants, which was about how people had already started to use the return on investment tool, and then had added to that with some other economic work, and now actually have a whole group of, you know, not just champions, but also people committing to actually doing, in their case, a citywide strategy on mental health, with a particular focus on prevention, and that they've done a lot of work on both the things about cost savings, moving money around, and also the financial argument, the strength of that financial argument that they've managed to construct, which we will try and make into a case study to share as well. But, you know, again, I don't think we would have discovered that or been able to share that in any other way than through the event.
Yeah, excellent. Anna, what's your highlight from yesterday? What would people get out of it if they were to come?
Yeah, I think my highlight from yesterday was when we divided the group into the local areas, and it was really great to hear the local areas kind of talk amongst themselves about all the different work that was going on and where it aligned, and just kind of sharing that learning. It was really great.
Excellent. And that was one of the points that did come up in the evaluation forms, that people really welcomed the space to have conversations they may not have had before, or if they had, it was in the context of something else. You know, it's at the end of talking about something else. Actually having the space to think and reflect and learn sort of together as local areas, and learn from those a bit further, I think was really welcomed. Anna, do we have questions?
We do, and please do keep sending them through, either using the question facility or emailing hello@kaleidoscope.healthcare. But we have a question from Sean, and thank you, Sean. So just to clarify a bit about where this work, I guess, fits into other work that's going on in the field. So is this different from the Time to Change campaign and the mental health champions that are offered free training?
Right, okay, so in terms of where this fits, so as part of the 5-year forward view for mental health, which was developed by the task force, there were a number of recommendations that came from that, and one of which was the Prevention Concordat, which we had actually asked for to be in a form. And what the idea, therefore, being this concept of better prevention planning arrangements and a change at a local level. So if you take that as an umbrella, then if you start to think of actually good prevention is also good suicide prevention. So, again, we would expect every area there's layers on top of and around and in between all the work that's happening already on suicide prevention. Similarly, the work, the free offer on being able for organisations to be trained on as mental health, to local authority members to be trained as mental health champions, and the campaigning work that's happening on Time to Change. Again, that wraps in and around this work as well, and we will be making the most of that. And add, so and also what we're also doing is making sure that for the signatories, we started off with an approach of where signatories suggest what you want to do, and we got staggered a bit really by the range of different types of offer. We're now going to amend that a little bit. Again, possibly to pick up on what you're saying is that we may then make that more into a menu of these are the sorts of things that we expect signatories or encourage signatories to be taking up. So those sort of things. So it's much clearer that actually again this layers into and links into other work and strengthens it.
Excellent, thank you. I think it was a point made by Victoria Blessard, who was at the event yesterday from Bristol City Council, where she was describing her approach to the Prevention Concordat as not about having a Prevention Concordat plan, but about actually how it, I want to use a better word than infects pretty much everything that the council's doing and wrapping in all these different initiatives as well. Excellent, good. So please do keep questions coming through.
Yeah, we have a couple more. So this is from Matt. Thank you, Matt. So Lily mentioned a new focus on housing. Is this predominantly about housing management, provision, design, or a bit of all of them? Okay, so this is something that initially came from the housing sector, and particularly the housing housing associations when we were first doing our development work, was that actually you've got, yes, there's about support, and we clearly would want more supported housing or more approaches to supported housing, and that's been trialled through things like Housing First. But also we have an opportunity by the fact of some housing providers actually have quite a lot of contact with people. So if you think about and the proposition that these organisations are starting to think about is that when people are doing their sort of their annual tenancy review, and this is particularly about the rented sector, or when they're doing the sort of annual gas checks and various other things, actually wouldn't it be a good idea if some of those staff were also trained in things like Connect 5 or mental health first aid and various other things? So not to make them a fully fledged mental health practitioner, but also that they're just a little bit more mental health aware and have more insights, both for the people and communities that they serve, but also for themselves and their own families. So we're trying to look at that way of approaching this workforce that's already in contact with a number of people already. And there were a number of other ideas as well that again we're going to sort of build that into actually might this be a good thing that a number of organisations all take forward. So that was where that sort of came from. So there may be a further pledge or compact or something like that we do with that.
Okay, it's a timescale, Lily, about when people might hear more.
So what we're wanting to do now, and again we have, as I said before, is that we're kind of made by some of the the response, and so we're kind of running to catch up a bit really on documenting all of the pledges that and commitments that are being made. What we want to do is we'll be announcing in February, we'll be announcing another additional group of people who've already signed up, and that will be local areas as well as organisations, and within the next 2 to 3 months we'll be formatting that into a sort of resource booklet so that it's very clear what people have signed up to and to do on that and to resource, and then also how you particularly at local area level or as organisations can pull down those resources and use them as you might wish to direct them, as well as what the original intent was.
Great. So watch this space.
Yes.
Lovely. Thank you, Lily. Anna.
Yep, another question from Ronan. So he's involved in his local CAMS STP rollout in East London and wondering how he can practically use this Concordat to engage partners across the patch. Any examples of good practice?
Yeah. So the first thing is that I definitely encourage you to be be part of one of the London events, come to one of the London events. See, that was until February, so we don't want to wait that long. Is that what we've thought about with children and young people is that there is a great opportunity, which is over and above the announcements that have been made about children and young people's mental health in schools, is that, so we are very keen to make sure that obviously that work is a success in terms of making sure that there is a lead mental health practitioner in our schools, but also we want to use what we know about, the preventing bullying being a really good way of protecting and preventing mental health problems. So again, what I would be interested in with you and your sort of work is thinking about, well, actually, how can we dovetail that into that sort of things like whole school approaches to preventing bullying in schools, and other things like that, again, which would actually link with the sort of the CAMS dimension.
Great, thanks, Lee.
Thank you. And just before I go on to the next question, we had a comment from Sian just to say thank you, and she would just like to add, it seems important not to duplicate resources, and that it would be great to collaborate and develop this really important prevention agenda. And part of registering with the Prevention Concordat is to look at action plans, and that it is very similar to signing the Time to Change pledge, both for individuals and organisations.
Oh, absolutely, and I think that is the one of the absolutely underpinning things that is almost it's unsaid because I haven't actually said it yet, isn't it? Is about not duplicating. So whilst we might have a number of people doing the same thing, like, so for example, a number of people signing up to Time to Change, or signing up to be champions, or signing up to do a particular type of training, what we want to do is marshal them so that the coverage actually increases rather than people sort of working over the same patch. So absolutely, completely agree with you, Sian, that that's one of the things that we not particularly at PHE, but also with yourselves as well, have responsibility to make sure that that's what we're doing. We're helping spread in a proper way, at the right thickness actually, but spread in a proper way that commitment and resource.
Excellent. And if you want to know more about getting that alignment right between the different policy areas, you could join our webinar next week, all about partnership and alignment working. Anna.
Yep, another question, thank you, Liz, is could you comment on the value of inviting colleagues from police, fire and rescue, DWP?
Yes.
Sorry, are they invited, Lily?
Yes.
Can they come on?
First of all, we have managed to just about issue invites to all of the fire and rescue services, and also they are we're working with them alongside this piece to sort of again look at, could there be a consistent offer or sign up from all the different fire and rescue services. But again, absolutely, fire and rescue, we're doing similar with police as well. With that, we aren't yet as coordinated as to doing a centralised invitation, but we definitely encourage you locally to be inviting them. We've had a suggestion at one of the pre-events that I was sort of involved in. When planning that actually we also, where you have a Coast Guard, we think about the Coast Guard too, inventing those. So all of those, again, those sort of whether you call them allied professionals or whether or not you call them actually, sort of activists in the community, we definitely want them there as well. And yes, as I said, I've already mentioned prisons and sort of probation service as well.
Excellent, good, a really strong point. And I thought that the range of people we had in Bristol was superb, and great to get that continuing. Anna.
Great, so thank you, Adrian, for this question. So Lily, what is your guidance on the best primary prevention interventions that local authorities, public health, NHS should run? Recent Cambridge University research supports mindfulness, others advocate parenting classes. What are you advising as the best programmes to run?
So we have a whole website full of this, and that's one of the so again, obviously the challenge is, what do you pick? If you were asking me to say what are the top 3-4 things to pick, then actually I would almost refuse to answer, because absolutely it really needs to work to what is the sort of the local picture, and what's the need and other protective factors in your area or the community that you're wanting to work with or support. So what we have done is, and it was one of our first steps actually, which is on that again, if you Google Prevention Concordat or go through preventionconcordat.com, you'll get through to the resource suite, which is really nicely labelled. In there are 3 documents I would point you to in particular. One which is Taking Local Action, which just maps out the evidence-based, the shortlisted evidence-based for interventions, again, whether you're looking for a particular life course or particular groups. But then we then take the next step further with that, is also do some guidance on actually how you do that selection. And then we then also add in another tool, which is the return on investment tool, and also other return on investment products, which signpost you to which are the interventions that also have cashable savings, evidence-based and cashable savings. So, again, the top two in there being work around sort of bullying and debt reduction of debt, problematic debt. And the idea of those, again, is not to say that those are the only ones that you should do, or that you should, should pick those above all others. But what they do is they actually, being cash releasing, enable you to broker a package of other interventions in as well. So you do, so again, in all cases, it will be a case of that you need to blend interventions rather than simply picking one or two. But the guidance is very clear, and actually quite, we've deliberately made it quite straightforward to read and easy to kind of grab. And where people want that further distilled or made into sort of, easy handouts and things like we are going to be doing that again, particularly so that, when you're doing briefings for making business cases and things like that, that becomes even easier for you to do.
And your point about local circumstances, Lily, just reinforces the importance of a really good joint strategic needs assessment.
Oh, absolutely. I mean, having worked, when I've worked in sort of 3 or 4 local areas now over time, and the first, if you don't know your area, then you are working, with not just one hand tied behind your back, 2. So that's the most important thing. And again, it also is that thing I said before, is that this is not a top-down, we all want everyone to do one thing. Although, actually, sorry, correct myself there. The one thing we do want people to do is do more focus on prevention and the prevention of problems, the promotion of good mental health. However, the action will vary. But again, start with the joint strategic needs assessment and move on to and that sort of assessment of needs, risk and protective factors, and then move on to the interventions.
Excellent. Lily, thank you. Anna.
We don't have any further questions at the moment, but I have one actually. Perhaps we could just share a bit about how we are making each of the face-to-face events applicable to local areas, and what we're doing to make sure that they're not all just kind of the same thing again and again. Do you want to start with that?
Yeah, so we've spoken a little bit about the speakers who are going to be at the event, but also sort of the discussion, the learning elements. And so what we're looking to do in terms of the speakers is have a mix of national colleagues, Lily, PHE colleagues, Andy Bell from the Centre for Mental Health, Chris Naylor from the King's Fund, giving a national perspective. But what we're equally interested in is speakers, both we run a panel discussion, we run mini workshops, is speakers from local organisations talking about what they've been doing, what has worked, what they found challenging. So it was great yesterday to have Victoria from Bristol City Council, to have Lynn Gibbons from South Gloucestershire talking about their work. And sharing actually what their approaches were, which were particularly focused at, particularly relevant to people coming from the organisations which were there. So it's this balance of sort of national and local speakers. But then the main focus of the face-to-face events is the discussion. Lily, you said earlier, sort of, we're trying to do face-to-face what you can only do face-to-face, and that's having really good conversations and discussions with people. So we're trying to facilitate as much as we can discussions around sort of key topic areas, whether they are how you best use the national tools and resources, or about how you combine approaches, physical and mental health, how you make the most of your local data. But then also actually try and facilitate conversations of people in their local areas, reflecting on what they've done to date, what they're particularly proud of, but also where could they prioritise their improvement. And to answer your question.
Yes, thank you very much. Just
excellent.
Throw that out there. So we have just a follow-up question from Adrian, just about finding that planning resource. Perhaps we can share the link to it afterwards. But did he hear right that your top 2 interventions would be bullying prevention and personal debt management skills?
That's my personal top 2, I have to say, if I'm allowed to be sort of personal thing, if pushed. So we and I think the reason for that being is that actually you automatically hit a number of ways of involving different parts of the system. So that is, whether that's with the debt work, is that, you know, we already have some really good examples of GP surgeries and other venues being used for things like citizens advice, and the Citizens Advice Bureau are going to be one of the new organisations that will be announcing have signed up in February. So, and again, they're going to be doing some more work on that, but it also plays to the evidence that, you know, people like Money and Mental Health have also demonstrated about, you know, actually that the impact that has on individuals, families and communities. So that's good. With the bullying one, again, is that, you know, obviously the primary target there is young people, but we know that if with bullying that you are absolutely, almost, if, you know, a child that's bullied has, you know, significant increased chance of having a mental health problem. And, you know, again, there's lots of evidence about the sort of detail of that and the impact on the individual, again, their communities, families, and also, you know, if you're in an organisation that's financially minded, the impact therefore on the state and the NHS. So again, there's so many different reasons to do those two as examples, and also the number of people that you can pull in to help support that. What I didn't say actually about the return on investment and why I sort of flagged that up was not just about the money element of it, but and the brokering, but also we've obviously, you know, we've done all the preloading of data on that for you. So, you know, if you're in Calderdale, then already all you have to do is go in, choose the intervention again, which might be about loneliness in older people, might be again about, you know, sort of, you know, early parenting support. Type that in, you'll get a readout of the, you know, what money will be returned, you know, in years 1, 2, 3 and 4 and 5, in fact, and also what and who it comes back to. So rather than the older way, which was it either goes to the NHS or it goes to the other local authorities, it breaks it down a bit more into it. Does it go to crime and justice? Does it go to the social care sector? Does it go to education? So again, so that's what I meant about the brokering and moving things around, is that one, being able to see from the intervention, it reaches, you know, a range of different people's objectives and target outcomes, but also you can use the money argument as well as to, you know, how to make sure that that works.
Lily, thanks.
Thank you. We have a question from Matt. Thank you, Matt, who asks, we rightly talk a lot about challenging stigma. Have you seen any great examples of this working in practice? And is there any guidance available on the best ways to talk about mental well-being in the local press and through council publicity?
So, I mean, I think I'd absolutely start with the time to change work, which has been, you know, incredibly impressive and continues to be something that, you know, we would want to be supporting and seeing it elsewhere. We also, I mean, and again, I've seen some good examples, which again, we probably need to be sort of just highlighting those, where local authorities and others have also taken that and used that to their, you know, either whether that's about campaigns to the broad community or to particular groups. But then there's also been some very tailored work that's been done by particular groups, and they, you know, so historically, people with lived experience, but also I've also seen some phenomenal work that's been done by children and young people, particularly adolescents, who've led the way on doing that destabilising work, both amongst themselves, but also with professionals and actually changing the direction of how people are seen, talked to, and also experience provision. And obviously some of that is very service focused, but again, a lot of it is also very translatable actually out to wider society. So I think that's where I would sort of start that again, which is very much time to change, looking at particular groups, the way you've involved the community, and then also again, like, you know, sort of tipping a bit into that sort of, you know, it's everybody's human right agenda as well.
Excellent, thank you. So just to say, if you do have further questions, reflections, please do share them. If you are with us in Bristol yesterday and wanted to share what you found particularly helpful, please do that as well. Lily, another one from me. So we have this string of learning events which are between now and the end of March. I presume that's not when all work, national work, and the French and Concordat stops. What comes after that?
Absolutely not. And again, the opportunity challenge we have at the moment is that, you know, like everyone, we're in business planning mode, and so some of the things that we are starting to look at what we will do next year, and which again, therefore the opportunity for you to influence that in real time is there. I mean, I see my sort of broad outline for next year is that, you know, we will have some more things where we are bringing people together, whether that's face to face or it's webinar, but we will continue that commitment, and also that, as I've indicated, partly through the housing example, is the, that growth of the communities of interest in terms of, particular sectors that might want to continue to develop. And where needed, additional guidance, or us using our influence, particularly our national influence on other organisations. And we already do that in terms of, sort of some of the advice that we give to sort of as part of government, if you like, but also, to colleagues in and organisations like NHS England and others, where we can actually sort of help more quickly shape what they do.
Lily, thanks. And I think one of the points which came through yesterday is that, of course, there's all the work going on at the sort of PhD national level, but also the sort of the local PhD centres and the sort of particular PhD centre leads have a really important part to play here.
Yeah, and we've got a great network of centre leads who absolutely, and I think that for many of you that would actually be your first point of call if you it's like kind of going across the sort of tiers, and in that they're a great resource both in terms of their knowledge of their area and who else is doing what near you, which you could easily learn and readily learn from, but also able to draw in examples and opportunities from elsewhere. And I and my other colleagues nationally are very regularly in contact with the centre leads, including where we think that or where you and we kind of come to the agreement that it would be useful for us as a national resource to come and either be part of your events or local conversations where that additional influence is useful. We absolutely would not be coming in and telling you what to do. That's not our role. But if it is helpful to help facilitate or support or move on a conversation, then that is something we would discuss with yourselves and the centre leads as well, as to whether or not that's what the best approach is for doing that.
Lovely. And so if people on the call, Lily, are wondering who their centre lead is, other than sort of putting some sort of bat signal in the sky, what's the best way to find out?
So the best way to find out, actually, if you absolutely don't know, then I would email publicmentalhealth.gov.uk and publicmentalhealth@.gov.uk. So that's all one word. And we usually will be able to kind of get you in touch within the day, if not quicker than that.
Okay, and that's a good website, a good email address for people to remember.
It's a really good email address for quite a lot of things, actually. So whether or not it's here we're talking about prevention Concordat, but if it's about suicide prevention or the interfaces with the overlaps with other work, actually public mental health @phe.gov.uk is a really good one too.
Probably less good for the football results.
No, we can't. With a bit of a lag on that.
Yeah, okay, right.
Baseball maybe, but not.
Viewer's choice coming up. Baseball. Yes, great. Anna, have we got further questions, or
we do not at this time?
Lily, I think we'll close just a little early, and it's absolutely fine. Any closing reflections?
Yes, so I think the lesson for me the great lesson for me from yesterday was that the reminder of the richness of what's going on locally, and that actually our best work is done when we're guided by some of the things that you have to say. And so I think that I'd invite you to we've said about that we'll be having sort of viewers, listeners' choice for some of the webinar discussions, and so I'd definitely encourage you to come up with some suggestions or people you'd like us to nobble and get speaking and having a conversation with you through this mechanism as well.
Really nice point. And it's certainly, if you're sitting there with a wish list of the people who you'd like to be hearing from in the webinars, this is exactly the right point to share those, as we are contacting people, well, not quite as we speak, but certainly at the moment. So we'd love to hear your views. Anna, a closing reflection?
Yeah, I think I am just looking forward to the rest of the events, and I will use that opportunity to flag that our next webinar is on the 18th of January at the same time, and that will focus on partnership and alignment. So please do sign up for that one if you haven't yet.
Excellent. So final reflection for me is that just once again to focus on this point about the breadth of the events, and that we had the question about police, fire, rescue. This is all of the events are for anyone working in organisations which has a role to play in preventing mental health problems and promoting better mental health. And so if there are people you work with, if you're joining us from an organisation where you're wondering about whether this is really for you, almost certainly it is. And so please do share and get the word out. And I think with that, we will close for today. Again, we've been recording today. It'll be on the website, and we hope to see you either in person at the face-to-face events or on a future webinar. Thank you very much, everyone. Goodbye.
Bye. Thank you.